Right, so welcome everyone. The session today is about the temporal, infratemporal, and the Pterygopalatine fossa. Whenever we talk about fossa or spaces, we need to consider them as a room. So they will have medial, lateral wall, anterior wall, posterior wall, a roof, and the floor. So today, and after this lecture, you should be able to know and review about anterior, middle, and posterior cranial fossa, describe and identify the bony relations and the contents of the temporal, infratemporal, and pterygopalatine fossa on skulls and models, describe and discuss the boundaries and communications of those fossa and identify their contents in models and images from your photographic atlas, and appreciate the three-dimensional anatomy of these structures. Sorry, I didn't introduce myself. My name is Montserrat Ryman. I'm a dentist. I know my accent is very strong. So if there's anything that you don't understand, please let me know, and I'll go through that again. My email is there if you need to contact me after this lecture as well. So we will begin with a bit of osteology. And in general, why it's important to know about these spaces, because they can communicate with each other and they will cause infections, or infections can propagate between these different spaces. So you need to know how then they can communicate with each other. So here we have a typical image of the skull, and this is our starting point for today. The extracranial spaces of the head are located outside this skull, and we will focus today on these three only. So temporal fossa, infratemporal fossa, and the Pterygopalatine fossa. The temporal fossa, and let me put the pointer, there we go. So the temporal fossa is this one here. Infratemporal fossa is the space that you can see here, and the Pterygopalatine fossa, located there, is what we will detail in a bit. Again, temporal fossa, now with muscles. Infratemporal fossa located here. So we will begin with the temporal fossa. This one is a depression located in the lateral surface of the skull. This temporal fossa has different boundaries, so they are described here. So superiorly, we have the superior temporal line. This fossa will communicate with the infratemporal fossa inferiorly. So the inferior aspect of this fossa is the zygomatic arch, where we can communicate with the infratemporal fossa. We have also medially the middle wall made of 4 bones that you know. These are the frontal, the parietal, temporal, and zygomatic. When they join, we have a typical point, and that point is the pterion. Laterally, we will have the temporal fascia. Anteriorly is the frontal process of the zygomatic bone and the zygomatic process of the frontal bone. And as we said, inferiorly we have the zygomatic arch, and we will connect it inferiorly with the infratemporal fossa, as you can see there. So remember that the superior temporal line is the attachment for the fascia, whereas the inferior temporal line is the attachment for the temporal muscle or temporalis muscle. Now the contents, here we have the temporalis muscle, superior temporal artery, which is a branch of the external carotid artery. There are branches of the trigeminal nerve, particularly its mandibular division. So here we will have anterior and posterior branches of the deep temporal nerve, auriculotemporal nerve, zygomaticotemporal, and temporal branches of the facial nerve as well. The main content is, so this fossa is fully occupied by the temporalis muscle. Any question about this one? No? Right, and so we move now to the infratemporal fossa. So as a brief description, the infratemporal fossa is an area between the posterior aspect of the ramus of the mandible and the lateral plate of the lateral pterygoid plate of the zygomatic bone. It's located posterior to the maxilla. And this fossa will allow passage for the mandibular nerve that will be passing from the cranial cavity to the oral cavity. So you will find here that we have the foramen ovale there, and that is where the mandibular nerve will be exiting the skull and then going anteriorly, inferiorly, and will pass into the oral cavity. So, of the four muscles of the mastication, the masseter is lateral to the infratemporal fossa. Medial and lateral pterygoids are located here in the infratemporal fossa, because remember that medial and lateral pterygoids are associated to the lateral pterygoid plate, so both are coming from that plate. The difference is that the medial pterygoid is coming from the medial aspect of the lateral pterygoid plate, whereas the lateral pterygoid is coming from the lateral aspect of the lateral pterygoid plate. Now the boundaries are summarized here, and we have that the roof or the superior aspect of this fossa is made by the inferior surface of the greater wing of the sphenoid and the temporal bone. In here you will find the foramen spinosum, the foramen ovale. You can also find the retrotympanic fissure. Laterally, we will have the ramus of the mandible, which contain opening to the mandible, so that will be the mandibular canal. We will see these branches in a bit. We have medially the lateral plate of the pterygoid. We also have pharynx. We will have as well two muscles of the soft palate, which are the tensor and the levator palatine muscles. And here we have the pterygomaxillary fissure in the medial wall, that one there, which will allow the entry to the pterygopalatine fossa. Sorry. So I imagine this as the borders of the door. So the pterygomaxillary fissure is the borders of the door, and the pterygopalatine fossa will be this one. So outside we have the infratemporal fossa, and we have to cross the pterygomaxillary fissure to be able to enter into the pterygopalatine fossa. Anteriorly, we have the posterior surface of the maxilla, we can see here, and also the upper part will open in the inferior orbital fissure to open into the orbit. Now, a little bit more of detail here in this diagram. On the right, you can appreciate the bones and the different landmarks that we have in this region. So it's just the same as we have talked about before. The maxilla bone there, we have the tuberosity of the maxilla, so just different landmarks. Tuberosity of the maxilla, the alveolar processes of the maxilla. Here you have, that is the pterygomaxillary fissure, lateral plate of the pterygoid process there, that is the medial plate, a bit more located, sorry, it's that one there, located a bit more medially. So the lateral plate there where we have the insertion of medial and lateral pterygoid muscles. Now we have a lot of structures that are located in this fossa. So as the major contents, we will have medial and lateral pterygoid muscles. You can see one here. Which muscle do you think is this one? Because you will probably see this in the prosectorium. How to discriminate between these different muscles. So in this one here we have masseter, that is covering the angle and the ramus of the mandible. Then in this diagram they have done a section through the mandible, so they have taken the ramus of the mandible there, and you can see a bit in the internal aspect of the mandible attaching into the angle, but internally that will be which muscle do you think? Could be the medial or the lateral pterygoid. That is the medial pterygoid. So the medial pterygoid will go from the lateral plate of the lateral pterygoid process to, but the medial aspect of it, to the medial aspect of the mandible, or internal aspect of the mandible. Whereas the lateral, which is that one there, the lateral pterygoid goes from the lateral aspect of the lateral pterygoid process to the condyle of the mandible, so a bit more superiorly located. What other contents we have here? We have maxillary artery. We also have the branch of the trigeminal nerve that we saw before, that is the third branch, or mandibular nerve, and its branches. you will also be able to find a ganglion, that is the otic ganglion. So very close to the ear you have the otic ganglion. Some branches of the facial nerve, glossopharyngeal nerve, pterygoid venous plexus, and the sphenomandibular nerve, ligament, sorry. Now, this is some like a dissection that you will be able to see in the prosectorium, and you can have in your prosec exam these structures pinned, so that is why it's important to know them. How to recognize them? These are branches of the mandibular nerve, and you have this nerve that is the inferior alveolar, which is this one there. So that there, that is the mandibular one, and this one is given one branch here going into the mandible. So if you see a nerve that is going in the mandible, that is always inferior alveolar nerve. And you can see this one here that is going anteriorly, and that will innervate the tongue. So that one is called lingual nerve. So you will see that one a bit more anteriorly, and that will go more medially because it has to go and innervate the tongue, whereas the other one goes inside the mandible to innervate all the root of the teeth. Questions here? No? Right then, so there are also some foramina and openings here that will connect the infratemporal fossa with the intracranial or the cranial cavity. So here we have this foramen, that is foramen ovale, and very close to it we have foramen spinosum as well. So I took this caption from Complete Anatomy, as I wanted to show you the foramen ovale, but from another perspective. So this is like an lateral inferior view, and this is an inferior view of the skull from an external aspect, and we can see the relations with the infratemporal fossa here. So on the right side we have how the mandibular nerve is exiting through this foramen. Now remember that from the trigeminal we have, it's called trigeminal because it has three branches: ophthalmic, maxillary, and mandibular. So the one that you can see here is the mandibular division. Now the trigeminal nerve is considered a mixed cranial nerve. That means that this one carries sensory but also motor. But of the three branches, ophthalmic, maxillary are purely sensory. The only one that is carrying the motor component is the mandibular division. So that is what you can see there. That little root, that is the motor root that will be the motor component for the mandibular division. What else? So that is the little motor root of the mandibular nerve. So this is the mandibular nerve exiting through the foramen ovale and going into the infratemporal fossa. This is a lateral view of it, and those are the different branches of the mandibular nerve. But I've tried to make it a bit easier, and this mandibular nerve will have an anterior division and a posterior division. So you have that one highlighted there is the anterior division, and this one here is the posterior division. And to simplify this, hopefully, I have this diagram from Edinburgh, from the master, and I think it's super easy, or easier than the ones that we find always in the textbook. So we have mandibular nerve exiting from the foramen ovale, and that other foramen there is the foramen spinosum. So we have the mandibular nerve, and just as it exits, it gives two branches, a sensory branch and a motor branch. So we have the motor branch, which is the nerve to the medial pterygoid, and the sensory, which is the nervus spinosus. Guess where that one is going? Into the foramen spinosum, and will go to innervate meninges. And then it continues inferiorly and is given the anterior and the posterior division that we just saw. The posterior division is mainly sensory, and the anterior division is mainly motor. So both divisions will give 4 branches each. The posterior division give 3 sensory and 1 motor. So the 3 sensory ones are the auriculotemporal nerve, lingual, inferior alveolar, and the only motor is the nerve to the mylohyoid to innervate the mylohyoid muscle. And the anterior division is mainly, or has mainly, motor branches and only 1 sensory. So here we have deep temporal nerve, nerve to the masseter muscle, nerve to the lateral pterygoid, and buccal nerve, which is the only sensory branch. So, in summary, this nerve will give sensory innervation to the skin of the lower face, cheek, the lower lip, anterior part of the external ear, so just a bit of the external ear. It will give a little bit to the external acoustic meatus, temporal region as well, through the auriculotemporal, there. So that is sensory, and will give 2 different muscles. Maxillary artery now. This artery is located in this fossa. This artery has like 15 branches. You don't need to know all of them. Some of the branches are the inferior alveolar artery, and that one will go with the inferior alveolar nerve in the mandible. We also have the middle meningeal artery that is typical. You always hear from that one because that one is going through or a bit deep to the pterion. So that one can get rupture if there is a trauma in the pterion. So the middle meningeal artery is a branch of the maxillary artery. And the maxillary was a branch of the external carotid, as we said before. And we'll give several branches. You don't need to know all of them. I'm just showing you the contents of the infratemporal fossa. What else? We have this pterygoid venous plexus located in the infratemporal fossa. And this is a plexus of veins that will communicate extracranial tissues with the cavernous sinus that we know that is located intracranially. So infections that are located in the extracranial cavity can communicate with intracranial spaces and drain in the cavernous sinus. So because this is covered by meninges, it can lead to meningitis. So this is the pterygoid venous plexus there. Questions from here? No? Right then. So now the Pterygopalatine fossa. This fossa has like an inverted tear shape. This fossa is very small, but it will communicate, you will see that it will communicate with so many spaces. It's located posterior inferior to the orbit, just posterior to the maxilla, medial to the infratemporal fossa, as we said before, and from the infratemporal fossa we have to pass this pterygomaxillary fissure to enter into the pterygopalatine fossa. So this one extremely relevant clinically because we'll communicate with so many other spaces. So if we look at this diagram, you will have, for example, foramen rotundum communicating with the middle cranial fossa. We have the pterygoid canal, and spinopalatine foramen communicating with the nasal cavity. So a lot of spaces. Communication between spaces. So the boundaries of this fossa. Anteriorly, we have maxilla, or the posterior aspect of the maxilla, the posterior surface of the maxilla. We have medially the lateral surface of the palatine bone, that blue one. Posteriorly, we have the sphenoid bone. So the sphenoid bone will make the posterior but also superior boundary. And laterally, we have that pterygomaxillary fissure. So it's just the opening leading into the infratemporal fossa. So it will communicate with infratemporal fossa, middle cranial fossa, the nasal cavity, orbital cavity or the orbit, the oral cavity, nasopharynx. So it's extremely small when you see it, but because of the different foramina that it possesses, it will communicate with many other spaces, and that is important to know because of, for example, infections. This diagram is from Netter's Head and Neck or Netter's for Dentists, and this is the only diagram that helped me to understand this fossa. As we said before, all these spaces, fossas, are, you need to know the boundaries, so the lateral, medial, superior, inferior, so this simplifies that. In the left here, so we have the lateral wall of this fossa, where we have one foramen only, and that is the pterygomaxillary fissure. Sorry. In the posterior wall, you will see that we have, for example, foramen rotundum, the pterygoid canal, the pharyngeal canal, and you have the communications in this diagram. So foramen rotundum will communicate with middle cranial fossa. The foramen, the pharyngeal canal, sorry, that will communicate with the nasopharynx. Middle wall, as we said before, has the spinopalatine foramen and will communicate with the nasal cavity. Superiorly, you will find the inferior orbital fissure, and that will communicate with the orbit. And inferiorly, you will find the palatine canal that will communicate with the oral cavity. The anterior boundary, we said, that was the posterior aspect of the maxilla. So, you know, when we use the pipe cleaners in the small room sessions. So every time that you pass a pipe cleaner, you usually open somewhere but when you put into the foramen rotundum the pipe cleaner, you will be stopped very quickly, and you are usually stopped because you cannot push anymore, because you will find the maxilla there. And when you find the maxilla, your pipe cleaner will be located in the pterygopalatine fossa. So it's exactly this. Imagine you are posteriorly there in the middle cranial fossa, we're passing this pipe cleaner through the foramen rotundum there, and that is the maxillary nerve that should be passing through it, getting into the pterygopalatine fossa. So these are the branches of the maxillary nerve that will be exiting the pterygopalatine fossa. For example, posterior superior alveolar nerve, we have infraorbital nerve, and also we have the artery, which is the maxillary artery, which will give branches here and will accompany the maxillary nerve and giving blood supply to different regions. Then another thing you need to know here is this ganglion. If it's called pterygopalatine fossa, anatomists are not very creative. What do you think is the name of this ganglion? If it's located in the pterygopalatine fossa. Exactly, pterygopalatine ganglion. This is the pterygopalatine ganglion. Now, which cranial nerves carry parasympathetic component? Does the trigeminal nerve carry some parasympathetic? No. So the cranial nerves that carry parasympathetic are only 3, 7, 9, and 10. So 3, 7, 9, and 10 will carry parasympathetic component. So you have from the cranial nerve nuclei 3, 7, 9, 10 the cell bodies located in the brainstem, and from there you have the preganglionic neurons. The cranial nerve number 7 will come here and will synapse with this ganglion. So there is a nerve that is called the nerve of the pterygoid canal, and that is coming from cranial nerve number 7. So that one is carrying fibers from cranial nerve number 7, because that one is originated in the middle cranial fossa when the greater petrosal nerve, which is a branch of cranial nerve number 7, is joined by the deep petrosal nerve, which is a branch of like the internal carotid plexus, which is carrying sympathetic fibers. So this nerve of the pterygoid canal is coming here. That one, that little one there, that one is carrying the preganglionic parasympathetic fibers. And if it's called preganglionic, means that it's before a ganglion. So it's associated to this ganglion. And again, a ganglion is a collection of cell bodies, yes. So these are the cell bodies of the postganglionic neurons that will, in this case, hitchhike, for example, the maxillary nerve or branches of the maxillary nerve to be able to innervate glands, such as lacrimal glands. So the branches of the maxillary nerve that will carry parasympathetic fibers, but remember that they are not originated from this maxillary nerve. They are just hitchhiking this nerve, are the zygomatic nerve, greater palatine, lesser palatine, so they will go to the oral cavity, help with minor salivary glands to produce saliva, and the nasopalatine nerve that is going to the anterior portion of the palate and also the medial wall of the nasal cavity. So yeah, I know this is overwhelming if you look at this diagram, it's awful. But I promise you, it's friendly. Start with the left one. So just looking at this with lateral wall, medial wall, posterior wall, and what struct or openings I will find in each wall. What spaces are communicated through these fissures. So the infratemporal fossa through the pterygomaxillary fissure, that is how they communicate with the pterygopalatine fossa. So start like that and then add the nerve and which nerve are the ones that will exit through each space or arteries to be able to give the blood supply to the different regions. And that's basically it. Is there any question? No? Thank you. The information was taken from these books and that, just in case.